Hi, my name is Vicki Sims. I'm a physical therapist at Gainesville Physical Therapy. I would like to talk to you today about piriformis syndrome. That's something I see a lot in my practice as I specialize in sacroiliac joint dysfunction. If you have a long-standing sacroiliac problem, many times you will develop a secondary piriformis syndrome. That's when the piriformis tightens up. It's a stabilizer of the SI joint, so it's trying to do its job, and it contracts and stays in that contracted state, a little bit of increased muscle tone, trying to hold the pelvis in alignment and providing more stability for walking. As it tightens over time, it will develop scar tissue or become fibrotic. Many times it can even get little tears where it inserts onto the hip. And it'll clamp down on the sciatic nerve, which runs directly underneath the piriformis at times. And that can give you buttock pain, hip pain, and radiating leg pain. Let's talk about the treatment for piriformis syndrome. The most conservative treatment is to stabilize the SI joint, either conservatively or surgically, and then to stretch the piriformis muscle. There's several piriformis stretching exercises you can do. You can sit and stretch this leg, crossing the ankle over the knee, and sit with that stretch for probably 30 seconds to a minute at a time and repeat it 3 times. Or you can lie on the back and pull this leg up and cross it over the other and pull the knee toward your opposite shoulder, which will stretch the piriformis muscle. Always the stretch should be held for 30 seconds and repeated 3 times. In addition to stretching it and stabilizing the joint, we can do deep heat treatment, or a physical therapist could do ultrasound. And also another modality that seems to help is dry needling. Many physical therapists are doing that, where they stick a needle into the muscle and it will make the muscle relax. Now, another treatment that's more invasive is that you could see your orthopedic surgeon, and he could give you injections into the tendon, right where it inserts into the hip. It's very much like a bursa injection. Now, the protocol I like to use that seems to work well is to have 1 injection, wait 2 weeks, and then have a second injection, wait 4 weeks, and have a third injection. During that 6-week period of time, the whole time you're doing your regular things, keeping your SI stabilized, stretching the piriformis, and it usually will get better with that program. If all fails, then there's always surgical release of the piriformis. We would never release the piriformis without surgically stabilizing the SI joint, because if you release it, many times it will increase the instability of the SI joint, because its job is to stabilize the SI joint. So we would stabilize the SI joint and release the piriformis, and if you release the piriformis, it retracts and gets off the sciatic nerve. You will have no dysfunction from this. The muscle has 2 functions. It stabilizes the pelvis, and you won't need that anymore if you've stabilized the pelvis through screw fixation or some type of fixation. And the second job it does is externally rotate the leg, and you don't really need it for that, as you have 3 other external rotators of the leg, and they will pick up and compensate for the loss of that muscle. But it will be released, the sciatic nerve will be released, and the pain generally will just go away, and you will feel much better. I hope that's helpful for your understanding of piriformis syndrome.